Right now, in a medicine cabinet not far from you, there is a small white bottle that you trust completely. You take what's inside it to sleep better, to calm your nerves, to settle your stomach, or to quiet an aching back. And here is what nobody at the pharmacy counter is going to tell you. Some of those everyday pills, taken month after month, year after year, can quietly switch off the exact part of your brain you need to remember your grandchildren's names. I want to be direct with you, because that is the whole point of this channel. This is not about one rare, scary drug. This is about ordinary medications, sitting in millions of homes, sold over the counter, or handed out on a routine prescription, that carry a hidden cost to your memory. And the people most exposed are exactly the ones watching this. Adults over 60. If you want medicine explained in plain language, with no drama and no sales pitch, subscribe to Dr. Brightwell and tap that like button. The goal is 100,000 subscribers, and you genuinely move that number. The system makes money when you stay medicated, not when you stay informed. I'd rather you be informed. Now, before I list a single drug, I need you to hear the one rule that matters more than anything else in this video. Do not stop any medication on your own after watching this. Some of these drugs are dangerous, even life-threatening, to quit suddenly. Your job is not to throw pills in the trash tonight. Your job is to walk into your doctor's office with the right questions. That is where the real protection happens. Let me show you the mechanism first, because once you understand it, every name on this list will make sense. Deep inside your brain, there is a messenger chemical called acetylcholine. Think of it as the ink your brain writes memories with. When you learn a name, recall where you parked or follow a conversation. Acetylcholine is doing the work. It is the single most important chemical for learning and short-term memory. Now picture a whole category of drugs called anticholinergics. The name simply means against acetylcholine. These medications work by blocking that messenger. Sometimes that is the intended effect, like drying up a runny nose. Sometimes it is just a side effect the manufacturer shrugs at. But to your brain, the result is the same. You are running your memory factory while quietly cutting its ink supply. Here is the part that should make you sit up. For decades, doctors assumed this effect was harmless and temporary. Stop the drug, the fog lifts, no harm done. But long-term studies that followed thousands of older adults for years found something different. People with the highest cumulative use of strong anticholinergic drugs had a substantially higher rate of developing dementia. We are talking about a measurable rise in risk, not a rounding error. And the effect appeared to build with the total dose taken over time, like compound interest working against you. This is why the speed surprises families. Someone is sharp at 68. By 70, they're losing words, repeating questions, getting lost on familiar roads. Everyone assumes it's just aging or early Alzheimer's. And in a real number of those cases, a piece of it, sometimes a large piece, was sitting in the pill organizer the whole time. So, let me walk you through the 9 I worry about most. Pay attention to how many you recognize. Number 1, diphenhydramine. You know it better by its brand names, found in the pink allergy pills and the nighttime sleep aids marketed for rest. The very thing that makes it knock you out, blocking histamine, also makes it a powerful anticholinergic. A single dose to get through a bad night is one thing, but taking it as a nightly sleep crutch for months is one of the most common, most overlooked memory risks I see. It is sold as harmless precisely because it is sold without a prescription. Number 2, benzodiazepines. These are the calming medications prescribed for anxiety, panic, and sleep. They quiet an overactive nervous system, and for a person in genuine crisis, they can be a real tool. But used long-term in older adults, they dull the formation of new memories and slow mental processing. And here is the danger nobody mentions. You must never stop a benzodiazepine abruptly. Sudden withdrawal can cause seizures. This is exactly the kind of drug where you taper slowly, only under a doctor's supervision. Number 3, the sleep drugs often called Z drugs. These are the prescription pills designed to replace benzodiazepines for insomnia. They were marketed as cleaner and safer. In practice, they hit many of the same brain receptors, leave older adults groggy and unsteady the next day, and are linked to confusion and a higher risk of nighttime falls. A fall and a fractured hip can do to an independent life what dementia does, just faster. Number 4, oxybutynin and similar bladder medications. These are prescribed for overactive bladder, the urgent, frequent need to urinate. They work by, you guessed it, blocking acetylcholine in the bladder muscle. The problem is, the drug doesn't stay in the bladder. It crosses into the brain and blocks the same messenger there. This is one of the most strongly linked drug classes in the dementia research, and it's handed out constantly to people over 65. There are newer bladder drugs that don't cross into the brain the same way. That is a conversation worth having. Number 5. Amitriptyline and the older tricyclic antidepressants. Today, these are often prescribed in low doses, not even for depression, but for nerve pain, migraines, or to help with sleep. Patients rarely realize they're taking an antidepressant at all. They are among the most potent anticholinergic drugs in common use. A small nightly pill for back pain can carry a heavier brain burden than people ever imagine. Number 6. Proton pump inhibitors. These are the long-term heartburn and acid reflux drugs, the ones people take every morning for years, and simply forget they're even on. The concern here is different. It's not primarily anticholinergic. By suppressing stomach acid for years, these drugs can quietly impair your absorption of vitamin B12. And a long-term B12 deficiency produces memory loss, confusion, and nerve problems that look exactly like dementia, but can sometimes be reversed if caught. A simple blood test checks your level. Almost nobody on these drugs gets that test. Number 7. Opioid pain medications. Prescribed after surgery, for injuries, and for chronic pain. In the short term, for real pain, they have a place. But used long-term in older adults, they cloud thinking, slow the brain, and are associated with cognitive decline. And like the benzodiazepines, these are not drugs you stop cold turkey. Stopping suddenly can make you violently ill. Tapering is a medical process, not a weekend project. Number 8. Muscle relaxants, especially cyclobenzaprine, prescribed for back spasms and stiffness. Its chemical structure is closely related to those old tricyclic antidepressants, which means it carries a real anticholinergic load and a strong sedating effect. In an older body, it lingers longer and hits the brain harder than the prescriber often expects. Number 9. Certain antipsychotic medications used off-label. Sometimes these are prescribed in low doses to older adults for sleep, agitation, or restlessness, often without a formal psychiatric diagnosis. In people with dementia or at risk for it, this class carries serious warnings, including sedation, faster decline, and increased risk of stroke and death. If an older family member was started on one of these just to help them settle, that deserves an immediate direct conversation with the prescribing doctor. Now, let me tell you about a patient. I'll call her Eleanor, 71 years old, retired school teacher, the kind of woman who did the crossword in pen. Her daughter brought her to me, convinced she was watching her mother slip into Alzheimer's. Eleanor was foggy, repeating herself, struggling to find words, sleeping half the day. I didn't start with a brain scan. I started with her medication list. And there it was. A nightly over-the-counter sleep aid she'd taken for 2 years, a bladder pill from her urologist, a low-dose amitriptyline another doctor had added for her aching shoulder, 3 separate prescribers, none of them looking at the full picture, and not one of them had added up the total anticholinergic load landing on this woman's brain every single day. We didn't stop anything overnight. We worked with her doctors, one drug at a time, over several weeks, replacing what we could and tapering what needed tapering. 10 weeks later, her daughter called me, and she was crying. I got my mother back. Eleanor was doing the crossword again, in pen. I am not promising that outcome to everyone. Sometimes dementia is dementia, and no medication change reverses it. But I have seen too many Eleanors written off as hopeless when the truth was sitting in the pill organizer. You owe it to yourself to rule that out first. So, how old are you right now? Write it in the comments. Your age matters here, because after 65, your body clears these drugs more slowly, and your brain is more sensitive to every one of them, which is exactly why a dose that was fine at 50 can fog you at 72. Knowing your age group helps me focus future videos where you actually are. Here is your action plan, and it costs you nothing but a little courage. First, gather every single thing you take. Prescriptions, over-the-counter pills, sleep aids, supplements. Put them all in one bag. Most people genuinely cannot recall their own list, and the danger lives in the combination. Second, take that bag to your doctor or pharmacist. and ask one specific question. Do any of these have a high anticholinergic burden, and is there a safer alternative for someone my age? That phrase, anticholinergic burden, tells them you know exactly what to look for. Third, if you take a long-term acid blocker, ask for a vitamin B12 blood test. It is cheap, it is simple, and it can catch a reversible cause of memory loss. Fourth, and I cannot say this enough, do not stop anything on your own. Benzodiazepines, opioids, and several others can be dangerous to quit suddenly. Every change goes through your doctor. Your job is to start the conversation, not to play pharmacist. Stepping back, here is the truth. Dementia is not always a slow, mysterious fate that arrives out of nowhere. Sometimes it is a predictable, partly preventable process, and sometimes a piece of it is being refilled at your pharmacy every month. The fog that families accept as just getting old is, in a real number of cases, a chemical fog, and chemical fog can lift. Everything I covered today is for your understanding and education. Your situation is specific to you, and using this as the starting point for a real conversation with your own doctor will always beat trying to manage it alone. If this made a complicated topic clearer, subscribe to Dr. Brightwell and hit like. That is how we get closer to 100,000 people who refuse to be quietly medicated into the fog. Because the healthcare system profits from you staying on the prescription. I profit from you understanding it. Subscribe if that difference matters to you.